Uveitis is an ophthalmologic disease condition. Look at this picture shows that eyes affected by uveitis. Then fluorescent angiography and optical coherent tomography for diagnosis. Detail going on. Introduction. Uveitis is a broad term referring to inflammation of the uvea, the middle layer of the ear, which includes the iris, ciliary body, and choroid. It is potentially sight-threatening condition requiring prompt diagnosis and treatment. Uveitis can occur due to infections, autoimmune disorders, or unknown causes and can lead to severe complications if not managed properly. A definition: uveitis is the inflammation of the uveal tract of the eye, including the iris, ciliary body, and choroid. It can affect one or both eyes and may also involve surrounding structures like the retina, vitreous humor, and optic nerve. Etymology: the term uveitis comes from the Latin word uva, meaning graph, referring to the uvea, the middle layer of the eye that appears dark and grape-like. The suffix "itis" of Greek origin meaning inflammation, indicating that uveitis is a inflammation of the uveal tract. Types: 1. Anterior uveitis or iritis, inflammation of the iris and ciliary body. 2. Interior mediate uveitis, involves the vitreous humor and pars plana. 3. Posterior uveitis affects the cochlear retina and optic nerve. 4. Panuveitis involves all parts of the vital tract. Causes: 1. Autoimmune diseases, example rheumatoid arthritis, ankylosing spondylitis. 2. Infections, example tuberculosis, syphilis, herpes, toxoplasmosis. 3. Trauma or injury to the eye. 4. Drug induced reactions. 5. Idiopathic causes or unknown origin. Risk factors. 1. Autoimmune conditions, example lupus. 2. Genetic predisposition, HLA-B27 association. 3. Infections. 4. Smoking. 5. Trauma to the eye. Complications. 1. Cataracts. 2. Glaucoma. 3. Macular edema. 4. Retinal detachment. 5. Permanent vision loss. Pathophysiology. Uveitis occurs when inflammatory cells infiltrate the vital tract due to immune dysregulation or infection. This leads to increased vascular permeability, protein leakage into the aqueous and vitreous humor, and structural damage to ocular tissues. Inflammation disturbs normal visual function, potentially resulting in reversible damage. The pathophysiology of uveitis involves a complex immune mediated inflammatory process. Here is step by step breakdown. 1. Triggering event. Antigen exposure. Uveitis can be triggered by infections, bacterial, viral, fungal, or parasitic autoimmune diseases. Example ankylosing spondylitis, trauma, or idiopathic causes. In autoimmune cases, the immune system mistakenly recognizes self antigens in the uveal tract as treating. 2. Activation of innate immune response. Pathogen associated molecular patterns or damage associated molecular patterns activate antigen presenting cells like macrophages and dendritic cells. APCs release pro-inflammatory cytokines and chemokines leading to leukocyte recruitment. 3. Adaptive immune response activation. APC present antigens to naive T cells in lymphatic tissues. CD4 plus T helper cells differentiate into Th1 and Th17 subtypes which produce IF and IL-17, other pro-inflammatory mediators. In autoimmune uveitis, autoreactive T cells mistakenly attack ocular structures. 4. Breakdown of the blood ocular barriers. The inflammatory response disturbs the blood aqueous and blood retinal barriers. Increased vascular permeability allows immune cells, T cells, neutrophils, and monocytes, and inflammatory mediators into this intraocular space. This results in aqueous flare, protein leakage, inflammatory cells infiltration, and formation of creative precipitous on the corneal endothelium. 5. Tissue damage and clinical manifestations. Inflammatory cells in the anterior chamber leads to symptoms like pain, redness, photophobia, and blurred vision. Chronic inflammation may cause complications such as sign, iris, adhesions, cataract, glaucoma, macular edema. If untreated, persistent inflammation can result in irreversible vision loss due to structural damage. 6. Resolution or chronicity. With treatment, corticosteroids, immunosuppressants, or biologics, inflammation can be subsided and the blood ocular barriers can be restored. If the immune response remains dysregulated, chronic uveitis develops, leading to recurrent inflammation and progressive ocular damage. Signs and symptoms: 1. Eye pain. 2. Redness. 3. Blurred vision. 4. Photophobia. 5. Floaters. 6. Decreased visual acuity. Diagnosis: 1. Comprehensive eye examination. 2. Sight lamp examination. 3. Fundoscopic examination. 4. Optical coherence tomography. 5. Fluorescent angiography. 6. Laboratory test, blood test, HLA typing, infectious disease screening. Nursing diagnosis: 1. Acute pain related to eye inflammation. 2. Risk for infection related to immunosuppression. 3. Disturbed sensory perception. related to blurred vision. 4. Anxiety related to potential vision loss. 5. Deficient knowledge regarding disease progress and treatment. Medical management. 1. Corticosteroids, topical eye drops, oral or injectable steroids. 2. Immunosuppressive agents, methotrexate, azathioprine, cyclosporin. 3. Biological agents, TNF inhibitors. 4. Antibiotic or antivirals if infectious causes is identified. 5. Mydriatic eye drops to prevent synechiae formation. 6. Intraocular implants for chronic or refractory cases. Nursing management. 1. Monitor visual acuity and eye condition regularly to educate the patient about medication adherence. 3. Administer prescribed eye drops and systemic medications. 4. Encourage protective measures, example eye hygiene. 5. Provide psychological support and reassure patients. Treatment options. 1. Pharmacological treatment, steroids, immunosuppressants, antibiotics. 2. Surgical interventions, vitrectomy for severe cases. 3. Laser therapy for retinal complications. 4. Lifestyle modifications, smoking cessation, infection control. 5. Alternative therapies, anti-inflammatory diet, acupuncture. Psychosocial medicine. 1. Patient education, informing the patient about disease progression, treatment, and preventive measures. 2. Counseling and emotional support, addressing anxiety and fear of vision loss. 3. Support groups, connecting patients with others facing similar challenges. 4. Coping strategies, encouraging relaxation techniques to manage stress. 5. Family involvement, educating family members to provide emotional and practical support. Prevention. 1. Timely treatment of infections. 2. Regular eye checkups, especially for high risk individuals. 3. Protective eyewear to prevent trauma. 4. Managing underlying systemic diseases. 5. Avoiding smoking and other risk factors. In conclusion, uveitis is a serious ocular condition that requires early diagnosis and effective management to prevent complications, and vision loss. A multidisciplinary approach, including medical, nursing, and psychosocial interventions, is essential to improve patient outcomes and enhance quality of life. Thank you. Have a nice day.